Hi, I'm Jackie Keenan. In Chicago Business Today, doctors react to healthcare reform. There's a lot of debate about how the new healthcare bill will impact businesses and patients. But how will it affect doctors, and what are their attitudes toward the reform? Well, most doctors seem to agree with some provisions in the recently passed legislation, like a new rule prohibiting insurers from refusing to cover those with pre-existing conditions. But physicians have plenty of concerns about the new regime. 1,000 doctors of all specialties were surveyed by the Medicus firm on their attitudes toward healthcare reform. The survey found nearly 63% of physicians feel health reform should be implemented gradually as opposed to having one sweeping bill. 33% of those surveyed said the bill will prompt them to retire early. 72% believe there will be a negative impact on their income.
I think the passage of the healthcare law speaks toward the conscience and also the ethic of our country.
Dr. George Condos is the chief of cardiology and a medical school professor at the University of Illinois Chicago Hospital. He's in favor of this legislation as he says ensuring everyone is the right thing to do.
I think the most significant thing is it brings both the patient and the doctors more in control of health care than, for example, the insurance industries.
The needs of a lot of the patients in terms of being able to get doctors and services still hasn't been completely addressed.
Orthopedic surgeon Dr. Dan Ivankovich treats only patients on Medicaid and with no insurance at all. He says specialists are already turning away Medicare and Medicaid patients due to lower reimbursements and is worried that this will get worse once 32 million more people enter the system.
What'll happen is there'll be many more patients that are brought into a system. Even though I take care of a significant amount of uninsured, there'll be a lot greater pool of patients that will be looking for care, and you'll have primary care physicians that will be unable to refer to specialists because there's just not enough slots to accommodate the numbers.
Dr. Condos says the system will eventually work through this problem if the number of primary care physicians increases. He says this will enable family doctors to catch ailments early before they need more specialized care. But the American Academy of Family Physicians says the shortage for these types of doctors will grow to 40,000 by 2020, and the passage of this bill puts that estimate higher. And with a 21% cut in Medicare and Medicaid reimbursements in this bill, Dr. Ivankovich believes the impact on income will discourage doctors from building a family care office.
If you get a 21% cut, for many people, Medicare can be up to half their practice. And just, mathematically, it can create an insolvent situation for a lot of doctors.
The new legislation does help primary care physicians with some costs and incentivizes medical students to choose primary care as their specialty. And that's all for this edition of Chicago Business Today. Be sure to tune in next week when we look at how the new healthcare bill will affect both small and large businesses. Thanks for watching. Have a great weekend, and we'll see you back here on Monday.